respected Vaidya Trigunaji, Vaidya Balindu Prakash, Dr. P.M. Vaidya sir, Madam Sucharita, and Vaidya Narendra Gujarati. I don't know. I am promoted as a legend just because of the absence of Vaidya Trigunaji. So I am just promoted as a legend now. Anyway, I just for my students, I just show you a few slides where before and after treatment, there are certain slides where you can see the first slide, a largely superiorly migrated left posterior disc prolapse. After 21 days of treatment, you can see it has totally it has relieved. So evidence-based approach of Ayurvedic treatment is a need of the hour, and you can see a polycystic ovarian cyst after 41 days of treatment, medical treatment. You can see it's totally released. Like that, we have 200 to 300 people of data available, and for my students, I just tell you, during our pre-Ayurveda days, we were all rational thinkers. We think about physics, chemistry, biology, etc. And everything we try to analyze in physics, chemistry. This when I was in pre-degree, I was just thinking physics, chemistry, and the Vada Pitta Kapha was seen only in front of a what you call laboratory, where Kapha is measured, etc. Okay. And when I started my undergraduate graduation first year, we started learning by heart because a teacher used to tell you should not question, just mug up what Acharya has told. And gradually, when the clinics came, then confusion started. What is Vadarakta, Vadashavanada, Raktavada? All these are all confusing terms. And we somehow passed that also. And then we came to the final year. Then what is the difference between upper motor neuron lesion and lower motor neuron lesion? Even now, you all people are passing through the same phase where what is upper motor neuron lesion and what is lower motor neuron lesion. And then we came to the warts. What happened? A person brought an ECG. The first thing you start, how to read this. You start breaking your head. And this is a journey of a BAMS student. So I tell all my students, clinical diagnosis is a brain game. A right move at the right time make you and your patient happy. I know we are running short of time, and what makes our profession a different one? Here, the decision you take on a very vital time is going to decide whether between the death and a survival of a patient. Here, the scope of error is nil. I have a friend who used to say, I do all work in my clinic. He's in Germany. Morning he comes, sweep the floor, then he cleans a table, etc. Then go back, have a shower, come back as a doctor. Then after that, in the evening, he writes accounts and then he starts marketing himself. So it's a bundle of profession, and we are all doing from so many of them are doing. So you are under a severe stress, and every day you have to learn also. What is the meaning of a clinician, physician? A person qualified to practice medicine, especially one who specializes in diagnosis and medical treatment as distinct as surgery. Vishanganam jyo vishajyati. A physician is he who treats patient who is well versed in the applied aspects of the meaning contained in terms of aphorism and who is well acquainted with all aspects of life. And then, though there is Chilsa Chadushpada, though we have four limbs, you are responsible for the success and the failure. Why? Because the virtue of knowledge, the administrative capacity, and also the coordination occupies the most important position, and you are doing all this. I'm running through all my slides because, and of course, you need good medicine also. Here, quality of clinician matters a lot. You should have an excellent medical knowledge, an extensive practical experience, a skillful or dexterity, and purity of mind. A good clinician should know dusham, desham, balam, kalam, analam, pragatim, vaya, etc., etc. And also, there are certain common qualities you expect in a clinician. First is compassion, work ethics, professionalism, knowledge, confidence, humility, and passion. And all these, I have a story to tell. And I know we are running short of time. So before before I stop, I'll tell you, you should go to the basics. You should go to the basics, because every time when you talk about anatomy, it is a basic. When you talk about physiology, that's also basic of. And when you talk about microbiology, that's also. But once you come to a disease, then you have to go for pathology and then medicine and treatment or surgical part. So basic, you should be very much thorough, and that is why RIV is trying hard to bring back all the basics in you. Explore the signs, and once a patient comes to you, explore the signs and symptoms, locate the lesion, identify the dosha profile, go to Vikalpa Samprapti, grasp the pathogenesis, design the treatment strategy. Upashaya and Anupashaya is the guidelines, and make necessary changes. So we should have a basic knowledge on modern medicine also, to get the micropathology, to get the nature of progression. Uh, I have lot to say in each and every slide for better understanding of disease. Being I do mostly of fracture treatment, so this modern knowledge is helping me a lot. I always urge my students, you should have a basic knowledge on modern medicine plus a, postgraduate knowledge on the Ayurvedic medicine. Conclusion: a clinician life is lifelong learning, and those situations should strengthen their resolve. Not all busy doctors are good, and not all good doctors are busy also. Confidence is the major criteria for good clinician, even though highly knowledgeable. So a few quotes: Vigaranama Akashilo, Nav Jihriyat Kadajana. That is, you, every seminar we used to hear this, and then Jnanamuddhi Pradipena, Yona Vishadi Tatvavit, Adurasya Andaratmanam, Nasa Roga Chilsa. You have to get inside the patient's mind or Atma, then only you will be able to treat. Acharyat Padamadate, Padam Shishya Samedeya, Sabrahmacharibhya Padam, Padam Kala Kramena Cha. So, Kojit Dharma, Kojit Maitri, Kojit Artha, Kojit Yasha, Karmabhyasa, Kojit Chedi, Chilsa Nasi Nishvala. These are the certain shlokas which I would like to say in the last. And finally, thank you. Thanks for the patient hearing. Thank you. Namaste.